When it comes to talking about how to achieve good health for all, we must talk about self-care. Self-care is about how we can take charge of our own health. While serious illnesses require care from medical experts, we can work on staying healthy by looking good, exercising, eating right kind of food, and also really look at our mental well-being. So we're going to be introducing our guests, but let me tell you something here, that self-care is not that we just don't take care of our health. We need to be cautious. So let me go across to Dr. Shravan. Before that, let's introduce the guests. Joining us is Ajaita Shah, founder and CEO of Frontier Markets. Shravan Subramaniam, President and CEO GE Healthcare India and South Asia. Dr. Jyoti Vajpayee, Public Health Specialist. Parul Ori, Chief Editor and CEO Momspresso. And of course, we have Ravi, who's still on the panel with us. Dr. Shravan, I would like to start with you here. Perhaps the single most common reason people give up for not participating in self-care is due to a lack of time. How imperative is it that we take out time in our daily lives, even if it's very little, and especially now in the middle of a pandemic?
I think that's a great question, and it's really important for us to recognize that it's not just about time. I think it starts with awareness. And one thing that the pandemic has helped us with is this profound awareness. For example, personal hygiene, we understand now is it's not just a choice, it's a necessity, and not just for us, but for our families and our communities. The same applies for fitness, it applies for mental health, it applies for nutrition. So I think awareness is the number one key. And we need to make this part of our dinner table conversation, that everybody is talking about this, and the pandemic has given us that opportunity where it is okay to talk about health, it's okay to talk about wellness, and it's really important to perpetuate that at the workplace and across our families. I think there's also been a lot of creativity in terms of wearables and other tools that are available to a lot of people, which make healthcare accessible. And I think this is where self-help starts from. It begins with awareness and having that conversation.
Dr. Jyoti Vajpayee, just want to ask you a few things. There are many stages in a woman's life, from puberty to childbearing to menopause. What is the self-care advice that you would give women through the different stages of their reproductive life?
Yes, sir. Right. So there are many stages, as you said, in a woman's life. Puberty is a time when hormones are being introduced into a child's body, and there are body changes. So it's a time of awe and wonder, sometimes anxiety, sometimes even you're uncertain, and there is certain discomfort. Your body is growing, you're getting facial hair, you're getting body hair, you're getting acne. Girls go through menstruation, the boys go through night falls, etc. So parents talking to children about taking care of themselves. The menstrual hygiene is important, and their emotional and physical support is very necessary. Pregnancy is, I think, it is a stage when a woman is most vulnerable in her life. There's an onslaught of a deluge of hormones, I would say. 6 hormones working on your body, which would give you morning sickness. It would give you, make you moody. You feel like crying. Yet, there is that joy of carrying another life. So a woman really needs to take care of her health. She needs additional calories. She needs to eat right, with good proteins and with vitamins. She needs supplements, the vitamins and the calcium and the iron, folic acid. She needs to do moderate to, mild exercise. She, she's growing heavy, she needs to know that, a left lateral position would give more oxygen to the baby growing inside her. And, and she needs to ask for help when she needs it. She needs to, take rest and be emotionally supported. Postpartum period is when the child, a few weeks after the child is born. It's a very happy period. But for some women, it can, lead to postpartum depression. This is time when all the hormones suddenly fall. So the woman may become, she may not be interested in the child.
Ji.
She may not be interested in feeding herself or the child. She may go through depression. So she needs to take care of herself, She needs to ask for help, sleep right. I know it's very difficult to sleep when you have a small baby in your arms, but she needs to sleep right, eat well, do some exercise, and be connected emotionally with her friends and family.
जी डॉक्टर वाजपेयी, अभी हम पारुल लोहरी के पास जाते हैं. पारुल जी, मॉम्स प्रेसो भारत का एक, इट्स इंडियाज लार्जेस्ट कंटेंट प्लेटफॉर्म फॉर मदर्स that I believe has over 30 million users. What are some of the worst cases of mothers not caring for themselves that you have come across on your platform?
There have been many cases, of course, and when we have our conversations with experts, when we have, in fact, this year we started with a discussion on what is your health agenda for the year, and that's when we come to know of these kind of cases. You know, it's women feel awkward and sometimes even selfish to actually shift the balance from everyone else care to self-care. So we've had, you know, very angry reactions from doctors who see the worst of it, severe conditions caused by neglect. It could be out of control blood sugar or even blood pressure. They talk about unexplained fatigue, headache, symptoms leading from anemia, nutritional deficiencies. And then there are those terrifying cases. You've got a leading oncologist who once told us about a lady who had ignored a lump in her breast because her son had board exams. And she didn't want to disturb him, you know, for anything. But by the time she saw the doctor, it was a huge, big, suppurating wound inside. The cancer had spread deep into the bone, and they just couldn't save her. So, you know, it's the weirdest reasons for which people are not really coming out and taking care of themselves. Then there are taboos. Periods are still not discussed openly. So obviously things like period pain is also hushed up, however severe it may be. It could be a symptom of a deeper underlying issue. Mothers don't even want to talk to their sons if they have gynecological issues or they've detected a breast lump or something. But what is most overlooked is mental health. We've come across many mothers, you know, in our community who say that they've dealt with postpartum depression without even knowing what it is, and that too for many, many years. So I think the problem essentially, it starts with women being held solely responsible for everything to do with the home and family. And it gets so overwhelming that she feels, or unfortunately is sometimes made to feel, that even taking time out for herself is a luxury she can't afford, that it's selfish. So that is what we need to change around.
How can mothers start to care for themselves?
I think conversations are the great place, sir. I mean, that is the very fact that we are having this conversation today, and we've seen that even on our platform. When women share their stories on platforms such as Momspresso, a huge amount of awareness and understanding happens, and, you know, women are encouraged to take some action. In fact, our Bangalore editor shared her experience with dysphoric milk ejection while breastfeeding her daughter. And it was the first time we were hearing of something like that. But the next time around, our viewers, our readers, they'll be a little more, they at least know it's a real thing. It is a, you know, treatable issue, or at least it's something that can be addressed. In fact, for many men and women who are professionally employed, companies have mandatory annual health screening. Most women do not come under that category, and they need that discipline to be imposed by themselves. I mean, it's great if it can be done by their family, but I think it's important that we women stop waiting for someone to take care of us. And that's why the term self-care is so important. So let's educate ourselves. Let's pay a little more attention to our bodies, and we will intuitively learn to recognize when there is something amiss. For example, in our discussion on prevention of breast cancer, the doctor spoke about how periodic and regular self-check can help detect, you know, breast cancer in early stages, and then it's treatable. So once you're in tune with your body, you know how it feels. When you do a self-check, you know if there's a difference. We need to be aware of the red flags that cannot be ignored. But that said, of course, annual consultations with your general physician, your gynecologist, a specialist if required, all of that is necessary. They will advise you about what blood tests you need to get done, frequency of pap smears, mammograms, all those essential screenings. And of course, I mean, the mental wellness aspect is cannot be underrated
Right,
at all.
Yeah, right, Parul, like you just said, it's so important we talk about it. Just by the way of introduction, Ajayata Shah, to what you do, you know, you've been working for the last 10 years through your social enterprise Tancha Markets, you know, which reaches the deepest villages in rural India, connecting rural families to solutions by investing in rural women entrepreneurs as Saral Jeevan Sahelis. So there are 10,000 such Sahelis and you're reaching 3 million rural citizens today. The reality of rural India is very different. What are the barriers to self-care in rural India? Jaita.
Thank you so much for that question, Ambika. I think a lot of what was said earlier still applies to rural Indian women. The challenges are just much harder because rural women don't have outlets. They don't have space to communicate. They're not connected to digital solutions. They're not connected to health infrastructure. They're not being given information that's adequate. They don't have spaces to speak. And fundamentally, they live in 700,000 villages all over the country. So on a fundamental level, what we see is all the barriers that mothers have, these women have as well. The difference is it's poor infrastructure, healthcare, poor education, and unfortunately, poor agency to be able to make confident choices and decisions. So there's a lot of isolation that we end up seeing there in India, which leads to more deaths, more illnesses, and because of the lack of infrastructure and capital, it's harder to treat.
Given this very enormous challenge, what is the opportunity? What can frontier markets and the Sahelis do to put this choice of self-care into women's hands and minds? And how do we address the women's basic needs enough that she can focus on self-care and on herself?
Yeah, great question. So I think that for me, what's been really interesting working with our Sahelis is they are ready for change. So one thing that we know very clearly is when women have access to income and they have access to digital connectivity, they feel very confident that they can take on the world. So our Saral Jeevan Sahelis today have become these health champions. They've become these social influencers. And so what they've been saying to us is they've been saying, Ajita, give us the opportunity to now tackle self-care. We know if we get access to the right information and we get access to the right solutions, we can bridge the gap for our fellow rural communities.
Yeah.
So what's exciting today, sir,
is that remunerative for them as well?
Yeah, so what's nice about our Sahelis is they connect to the self-help group networks in India. Today, there's about 165 million women that are part of the self-help group networks. They're eager to have action. They're eager to have connected to solutions. Sahelis become the vehicle to make that happen. And so today, Sahelis are sitting here saying, give me the tools, I have my technology, I want the opportunity, let me change rural India and create self-care in a way that can make the world change and create Swasth Bharat.
I'd like to ask Dr. Shravan another question. How does GE see an opportunity in self-care? Also to enhance the public healthcare system in the country. We believe GE Healthcare has partnered with, Dettol Banega Swasth India program, which is our program. Could you tell us something about that?
Sure. So there's a lot that we need to do to sustain the habits and what we have come to accept as good health habits. There's a lot of work that has been done and more that can be done. Over the last 75 years since independence, we've relied a lot on public health and our society to take care of health. I think the next 75 years should be about the empowered consumer. And I deliberately say consumer rather than patient, because we need to prevent healthcare episodes from taking place through screening and through other modalities that we have available. And this comes from knowledge which we really need to sustain. I think we need to learn from the best. We have great guidelines from the WHO and other countries. We need to follow protocols. We need to continue to invest in technology and develop and deliver access programs. Wipro GE is working with several governments across India, across, say, Northeast India, Goa, Uttar Pradesh, etc. We work with governments to skill build young people as well as trainers so that they can go into society and train people, particularly mothers, so that they know the health requirements for the family and they can work on it. One of the great tragedies of COVID over the last year and a half is the missed opportunity to treat many diseases, such as cancer, such as cardiovascular disease. Anywhere from 50 to 80% of cancer screenings have been missed, especially during the second wave of the pandemic. And that is truly a tragedy. It is preventable and something that we can act on. And this is where we need to work together across the community. Wipro GE is doing a lot of work, but we work with hospitals, governments, public-private partnerships. And ultimately, sir, we want to deliver an empowered consumer who knows about their health, knows about their family's health, and then they take action on it.
Right, Ravi, if I could ask you a question. We've learned so much in this whole pandemic, and one thing is we start bothering about self-care and looking after oneself because the public health system is so overburdened. So what are your plans in that area? Have you got any, because it's so crucial, because there's so much pressure at a time of a pandemic. Are you reaching out on self-help?
Thank you, Dr. Roy. So our plans are very ambitious. So we want to first start the self-care programs with new moms across India. And we have planned to reach out to 10 million new moms. And the year 2021 will be witnessing our reach to around 3 million new moms. We are taking 3 approaches. The first approach is basically the online approach, like we have the Mom Presso will be one of the partners for that. Second approach is a community-based approach where you're working with the indigenous populations, tribal populations, where you need hand-holding on the ground. So we have the partners for that. Then the third kind of partners we have, like the frontier markets, who will be basically working with us on the blended approach, where there are digital solutions as well as the community solutions, which will be going hand in hand. And the focus will be on the 3 broad areas on the self-care. The first is basically the hygiene. In hygiene, it's hygiene in home, hygiene in neighborhood, personal hygiene, hygiene during illness. So these are the topics which we'll be covering in the self-care. Second is basically on nutrition, which includes 2 aspects. Like we know, India is the anemia hub of the world. So more than 60% of the women in India and the girls are actually anemic. So how we can actually trigger the behaviors, the positive deviants, so that women food intake is better, and we have the less number of anemic women. Along with that, there's a significant investment we are doing on the self-care, like on the breastfeeding to the kids. We want if a mom is healthy, then only she will be able to take care of the kids. So there's a linkage between the two in the first 1,000 days. Third interesting concept is for the very small ailments also, people go to the secondary health facilities, tertiary health facilities. So, and the doctor to patient ratio and the beds per patient are very skewed. So by doing the self-care, for the basic ailments, people can actually watch out for themselves, the signs and symptoms. But again, it calls for a lot of awareness and a lot of action and a lot of nudges which needs to be used. So we are working towards that, what various nudges we can work on, so that we first target the new moms across India, and then we scale it up.
His granddaughter in the community aspect, I was really taken up by that solution. You heard this morning, yeah. What the name of the organization? ARA. Yeah.
Looking forward to
these are things that the young generation are doing. You guys are much better than us at action.
Yeah, and the best part is that they went out looking for funding. Some of them came from personal means, some from the family, but they were able to do all this on their own. Pick up the funding and have a business outlook to this. And these women that go out and they're thrown out of their homes during the time of their menstrual period and really looked down upon. That's terrible. So what she did was that they have built actual homes. If you see some of the pictures of where these women were sent to, you'd be appalled. I mean, एक ऐसे ही छप्पर बना हुआ है, टूटा फूटा कपड़ा, और कुछ नहीं, अगल बगल कुछ नहीं, not even a covering. So they've built a real home, with walls and curtains and toilet facilities inside, beds for them to rest, get them food to eat and stuff like that. That's just a wonderful idea. So yes, some of these ideas could be kind of propagated to the rest of the country.
And you could work with these. Fantastic.
So thank you so much, Dr. Vajpayee, Dr. Shravan and Parul for joining us. And let's move ahead. We've spoken about self-care. We've spoken how important it is for the mothers. So let's talk about maternal health. Improving the well-being of mothers, infants and children is an important public health goal and need for the country's growth, because their well-being determines the wealth of the next generation. It can also help predict future public health challenges for families, communities and the healthcare system. maternal health is closely linked to the health status of the girls and women in various stages of their life cycle. According to the data from the 4th National Family Health Survey, NHFS4, a quarter of women of reproductive age in India, when they're in the age between 15 to 49 years, they are undernourished, and 53% of girls and women in this age are also anemic. Joining us now, let me introduce them. Basanta Kumar Kark, he is recipient of the Global Nutrition Leadership Award. Dr. Raj Bhandari, member National Technical Board of Nutrition and Health, Niti Aayog. Dr. S. Shanta Kumari, President, FOXY. Dr. Preetha Reddy, Vice Chairperson, Apollo Hospitals. And of course, Ravi and Ajayta continue on the panel with us. Coming to you, Basanta, if I can start with you, an undernourished mother is likely to give birth to an undernourished child, resulting in a poor start in life and, setting up a life cycle of child undernutrition. Can you explain to us the importance of, starting this nutritional care right from conception, regularly following the mothers, the caregivers, intensively in the first 1,000 days? We've been talking about the importance of first 1,000 days. So how can we prevent maternal and child undernutrition?
Thank you so much. At the outset, I must compliment for choosing the theme, leaving no one behind. Worldwide, malnutrition outcomes are deeply unfair. There are social exclusions, geographical exclusions, there are also economic exclusions, and there are also policy level exclusions. And there are some people who are more malnourished in comparison to others. It could be tribal, it could be Dalit, it could be backward, and it could be also some of the states in comparison to another state, and people staying in some geographies. So if we want to really transfer the first 1,000 days, and which is the first window of opportunity, which starts from antenatal care till 2 years of age of the child, then definitely leaving no one behind is important. My special compliment. So it is necessary. Good nutrition is good life. I always think for a pandemic infection-free society, you need a malnutrition-free society. Good nutrition can supercharge demographic dividend. Good nutrition can bring growth, productivity, and increase GDP. It can also reduce mortality. For survival and thrive of the child, the investment in first 1,000 days, which is called first one window of opportunity, is important. But in order to invest on first 1,000 days, first window of opportunity, you need to invest on second window of opportunity, that is adolescent girls, where anemia is all pervasive and hidden hunger, micronutrient malnutrition is all pervasive. And first 1,000 days builds the foundation. If you want a good society, good nutrition, you have to build that foundation in first 1,000 days. So let me tell you specifically about how antenatal care or antenatal period is very, very important for the pregnant mothers. And pregnant mothers need full antenatal care. They need one additional meal. They need rest during pregnancy. They also need good mental health. And evidences suggest mental health as a bearing on low birth weight and also stunting, and which has implications on cognitive potential. And the 80% of rapid brain growth and maturity happens in first 2 years of life. So it is about brain, it is about immunity, it is about body, it is about growth, and it is about preventing infection and reducing mortality. So you need to invest. And many women during pandemic have been suffering from mental health. You know what could be the consequence. And they need one additional meal, because in India, you find around 15% children are born with low birth weight, and 1/3 of the low birth weight is attributable to maternal nutrition. So maternal nutrition, feeding, care, rest is important. Then let me come to when the child is born. It is very unfortunate that little more than 40% children are breastfed within 1 hour. What happens to another 60%? Why it cannot be 90%? Then exclusive breastfeeding is around 55%. What happens to another 45%? Why it cannot be 90%? But there are exceptions. There are districts, there are states who have performed well, and all of us know about that. And another important is the complementary feeding from 6 to 24 months, which is very important.
So you're saying some districts have 90%, so there is hope that you can change other districts as well. In fact, I wanted to carry on with that thought with Dr. Bhandare. Dr. Bhandare, nutritional deficiency, as we've just heard, is really a huge challenge in our country. And the connection between lack of nutrition or poor nutrition and immunity is so interrelated. How do we handle this a major macro issue?
This is something that we have been struggling to improve over the last many years. And what we find is at the current position that 1 in 2 child is anemic, 1 in 3 would be stunted, 1 in 4 child would be deficient in micronutrients and other things, and 1 in 5 would be wasted. Wasted is small and thin babies. So nutrition assumes a very important role in mitigation of malnutrition, which means undernutrition, overnutrition, and the hidden hunger, the micronutrient deficiency. So as you know, COVID basically paused the button and we started looking at our immunity. The immune function basically is the host response to any infection, whether it is bacterial, viral, or protozoal, and how do you combat that infection? The nutrition plays an important role because protein, for example, has a role to build up our muscle. Besides that, the immunoglobulins, and these immunoglobulins basically fight the infection. So the antibody response that we have, whether it is for the vaccine or towards the infection, it also depends on our protein. The other things like micronutrients, iron, zinc, vitamin B complex, vitamin D, vitamin C, all these basically have a very important function in mounting an immune response. They act as cofactors and coenzymes at the cellular level. So you can imagine that every single nutrient that we have in our diet will basically help us build on the immunity, apart from other factors like sleep and de-stressing and exercise. All those, of course, help. But the main things which modulate our immune response are the nutrients.
I'd like to just question Basanta Kar. We're talking about malnutrition and anemia, micronutrient deficiencies, stunting. Why should we all be concerned about these issues, even if they don't directly impact us?
In fact, there is a direct that if there is micronutrient malnutrition, which is known as popularly hidden hunger, it can create morbidity, it can create infections, and it will also reduce productivity. And there are many evidences suggest that stunting reduces productivity, and also anemia reduces productivity. Not only that, infant mortality which is a major area of concern. Around 45 to 50% of infant mortality is attributed to malnutrition. So it is about individual, it is about household, it is about society, and it is about country where nutrition, I think, should be a top investment priority.
My next question is to Pritha Reddy ji. You know, when you educate a woman, you're also improving her health. Gandhi ji said, educate a man, you educate an individual. When you educate a woman, you educate an entire family. So, what are the outcomes of those of a family? Most critically, those of her infants or the children. Since we know that only a Swasth Bharat can be a Sampann Bharat or a prosperous Bharat. would it be fair to say that any kind of prosperity begins necessarily with good health of our women?
Amitabh ji, namaste, and thank you for asking that question. You know, I come from a family where women are working constantly and we're strong women, so thank you for that. I think the Swasth Bharat has to be a Sampann Bharat, because women have to really join the workforce in whichever aspect we look at it. You know, they're strong, they're capable, and they're very committed to working. But it is kind of sad that in a country like ours, the DNA of an Indian woman or an Indian Nari is to put everybody else first before looking after her health. And I think that has really been one of the reasons why we're either talking about nutrition, we're talking about maternal mortality, simply because the focus hasn't been there, the communication hasn't been there, and that is something which is low-hanging fruit, and we need to step up on that. To do that, I think it has to be communicated that a pregnant mother has to be looked after in terms of nutrition, in terms of her checkups, and in terms of safe delivery. I know and I understand that health is in a way a state subject. You know, the nation, the central government gives the policies, they give the budget, but it's up to the states to do it. Every state has to be mandated to do whatever they have to do for women's health and nutrition. I'm also so glad that in some of the states, the drive towards vaccination has been very front-led by the women, especially in the rural areas. And that is like a pleasant surprise for all of us who are working there and, you know, working on the whole vaccination campaign. I also feel that we need to encourage, you know, India really has the power of a large workforce whose skill properly can actually be economically self-sufficient and empowered. And to do that, I think we need to focus on skilling for women, whether it is in the healthcare space or whether it is just for them to self-sustain something which they can do. And I'll give you an example. In my dad's village, they did some amazing things with the women, so much so they had the strength and the courage to stop alcoholism. So I think empowerment of women is very important, and especially education of women. And health and nutrition has to become a natural coexistence for them. And I'm sure we can do that.
Right. Oh, thank you very much. That was really, really important what you said. Yes, and the women in your family have really set a wonderful example. God bless you. I just want to take what you said onwards with Dr. Shanta Kumari. Amongst all the other challenges that women face, and my gosh, are there lots of challenges, violence against women, in fact, during the pandemic, it's gone up substantially. How does violence against women affect their health and their immunity at every level?
Violence against women is definitely one of the most shameful human rights violations. And we know that it knows no boundaries of geography, culture, or wealth. And we have seen during the COVID times that the violence against women has increased manyfold. And we need to understand the effect of this violence against women and how it is affecting women's health, especially women who are pregnant. It impacts the health of the woman when she's pregnant, and it increases the maternal morbidity and mortality. It can lead to abortions, it can lead to so many other mishaps during pregnancy. And when you look at it, at our country, how is it the sexual and reproductive rights are affected? Right from the womb to the tomb. You know, we find the female feticide, which starts right from when the girl child is there, to female child battering, female infanticide, sex-selective abortions. And when the girl is growing up, it can lead to child marriages, female genital mutilation, sexual psychological abuse, incest. And as the child is growing up, we now find that even in the adolescent and adulthood, there is dating, courtship violence, sexual abuse at the workplace, and sometimes, unfortunately, in these days, we find even cybercrime is also increasing. And we find this has a wide impact on the overall health of the woman. That's the reason why we have to actually sensitize our OB-GYNs and everyone at large that violence affects the woman's health at large.
Dr. Shantakumari, this is Amitabh Bachchan. I just have a question for you. You started an initiative that's called Dhira. Can you tell us more something about this? And when it comes to violence against women, how can all of us together, be part of the solution?
Dhira means courage. When I was the FIGO committee member on No to Violence Against Women, I initiated this Dhira. This Dhira is an initiative to say no to violence against women. This year, as the president of FOXY, my team has been FOXY for all, always, and Dhira, stop violence against women. We need to understand that unless we sensitize ourselves to this violence, which is affecting our women, we will not be able to help our women. Because what happens when a woman is affected with violence? Does she go to the police or the lawyer or anywhere else? No. She comes to a friendly obstetrician and gynecologist. That is the reason when I initiated Dhira, to sensitize our own members, OB-GYNs, to understand the effect of violence on women's health. And we say that it is to be advocacy to say no to violence against women. See, when we say Dhira, stop violence against women, we are not only saying that only women have to say no to violence against women. We need to make sure that the men also partner with us to say no to violence against women. The society at large also stands by the woman to say no to violence against women. And anytime you see any sort of violence being affected on any woman, nobody should just be a silent bystander. They should have the courage to stand up and say, this is wrong and we should stop. Only then we'll be able to make a mark, we'll be able to make a difference. And when we achieve this, I think that will be the biggest victory for the society as a whole.